Hey guys, this is Paul Lynch. I'm an anesthesiologist and pain management physician from Scottsdale, Arizona. I made my first video yesterday on COVID-19 for the first time in 6 months because this new Delta variant is sweeping through the country. And when I say sweeping, it's quite incredible what's happened. I'm coming to you again from the road. My son is an incredible golfer. By the way, 4th place in the world right now after 2 days at the U.S. Kids World Championships, and today's the last round. So I'm coming to you from the course. But I got so many questions yesterday after my first video, and I didn't even really have time to answer them all. So I thought I'd do a video today, update you quickly on the numbers and answer a few of the questions that came up. And so let me just start with the data. I'm on worldometers.info, and I'm going to put this in the link below so you can see it. In the video yesterday, I said that we were around 10,000 cases per day a month ago. Well, yesterday in the United States, we had 99,470 cases, so a tenfold increase in a month. That's crazy. We haven't seen this type of growth since March of 2020. If you look through the states in the United States, we had just tremendous COVID cases across the country. And so 26 states with at least 1,000 cases, being led by, of course, Florida. Florida has 17,000 cases in one day and 75 dead. Now, the concept of dead, so many people are saying, well, people are getting COVID, but they're not dying. They are. If you're vaccinated, you're not dying. And the data still seems really good that if you get vaccinated, that you won't die. But about a third of American adults have chosen not to get vaccinated, and that is their choice. And choices, as my mom used to say, has consequences. And the consequence of not getting vaccinated is if you get this disease, you're about twice as likely to die as someone who got the disease last year. So even with a smaller subset of people for this virus to rip through, namely a third of adults, there were 419 Americans who died yesterday, and that number is spiking very quickly. I'm gonna switch over on my computer here. I'm just kind of reading it to you guys today. I'm gonna put the links below, so if you're interested, you can track this stuff yourself. I'm on Our World in Data, and if you look at it, we bottomed out at about 200 dead per day on average about 4 weeks ago, and that number is around 360 today. So it hasn't quite doubled, but almost doubling the death rate in 3 weeks is quite scary. I'll do videos over the next couple of weeks on where this is going. I'm not quite sure today. It's hard to do the math on the amount of people that are unvaccinated and what the death rate's going to be, but it's going to be staggering this fall. I'm going to look on the Arizona website. I'll put this link below as well. I continue to be very disappointed in Arizona, and it's getting to the point, I live in Arizona, I can probably do something about it. They continue to mislead a lot with their data, so let me start with the high level. We had almost 2,000 cases reported, 2,000 cases, 1,965 specifically. We had 24 deaths yesterday. Arizona website and a big box says that the percent of people vaccinated is 52%, but that's a lie. 52% haven't been vaccinated, 52% have got at least one dose. If you look on the CDC website that tracks fully vaccinated, which is the mathematical model that we should be tracking, it's only 42% in Arizona. That's a big difference. And so we got to get that right, and we need to stop misleading people. We're not vaccinated when you get one dose. When you get one dose, it reduces your chance, but you are not fully vaccinated. And so that's an error. It also says with 3 asterisks for some reason, which draws your eye, that the percent positive was 9.7% yesterday. And that's just not accurate either. That's the percent positive over the last 18 months, which is a useless measure. And anyone in Arizona government who's watching this, you guys got to get this fixed. It's not right. The actual positivity rate over the last 7 days was 12%, which puts us in a high transmission zone. And so all the guidance coming out of the CDC on wearing masks indoors in high transmission or substantial transmission zones, Arizona, Maricopa County specifically, definitely qualifies for that. So I'm not going to get into the Arizona data too much more. What I'm going to do is I'm going to answer a few questions, and then I'm going to be done with my video for the day. So Let's start off, what's the Delta variant? I talked about it yesterday, but the Delta variant is what I'm calling COVID-21. It's very different than what you've experienced before. I got some questions on, does that mean the vaccine won't work? No, the vaccine does work against the Delta variant. It's just that it's a little bit decreased. You're a little bit more likely to get it. We're still trying to figure out the data, but it's probably 85% successful against getting it, maybe 90, but it's still like 99% successful at keeping you alive. I just want to say that again. It means if you've been vaccinated, you might get this Delta variant, but you're not going to die. And that's the key point. All the data that's coming out of every country says it's that this Delta variant spreads quicker, it's worse, you get worse disease, and it kills people more in the unvaccinated. And the vaccinated, you're a little more likely to get it, but you don't die. I hope that that's really clear. If you have more questions about that, you can put it below. Here's a question on, yesterday in my video, I said that as many as 2 million people in India may have died. And I got a lot of questions across various platforms asking me, was that an error? You know, the reported death rate in India was 400,000 this year. Well, there's lots of data that's coming out showing that the death rate could actually be 10 times higher than reported. So not even 2 million that I said, but maybe 4 million dead in India. They're calling it the largest humanitarian crisis over the last 100 years in India. I'm going to put some articles about that below. Why did this happen? Because the Delta variant is crazy. It's a new disease. The reason I'm calling it COVID-21 is because the R naught, I said yesterday the R naught could be 6, which means for every person who gets the disease, they infect 6 others. But now the data says it could be 8 or even 9. We're still trying to figure out exactly what the R naught is, but it's traveling very, very fast and very, very far. Do I need to wear a mask again? All right, well, that's the big question. I've been trying to get my thoughts together on this. I read everything on the CDC website. I think each person needs to make their own decision for their own kind of personal health. But the CDC is strongly recommended, even if vaccinated in indoor settings, that you start wearing a mask again, if you're in a high transmission or a substantial transmission area. The problem is every single day those numbers are going higher. And so now 80% of Americans are living in an area that's either substantial or high transmission, including where I live in Maricopa, including where I am today, North Carolina. So begrudgingly, I'm going to start putting my mask on again. I don't want to wear a mask, but I think it's the right thing to do right now. This isn't forever. It's for a time. We need to get this under control. What's closely tied to this is, what about your kids in school? Well, the CDC is saying your kids should put a mask on as well. And I got lots of questions about why would my kids need to wear a mask in school? And so I came up with 4 reasons. Number one, kids mostly aren't vaccinated. It's not even approved for kids less than 12. That will probably change in September, where we'll see approvals for Pfizer's vaccine for 5 to 12-year-olds, we believe. But right now, most kids aren't vaccinated. So every time they go to school, it becomes like these little super spreader events. Number 2, the Delta variant does appear to spread quicker in kids and more than the variants before. Number 3, there's about 10 million Americans that even if they're vaccinated, it just doesn't work for them because they're immunosuppressed. Someone who has cancer, someone who just had, say, a kidney transplant. And so a lot of these could be teachers that are around your kids, and they've been vaccinated. They're doing everything they can, but they still get very sick. And so we do need to make some decisions based on this vulnerable population. And then another one, and a lot of my patients have talked to me about this, is my 4th reason, is if kids aren't wearing masks in school, based on all the data coming out of India and what's going on, there's some parents that just aren't going to send their kids to school. And so there are all these children that won't be educated. And so even though masks seem like anathema to some people, to put a mask on and go to school and get educated is probably the right thing to do right now. It's certainly what the CDC is recommended. I've got a bunch more questions. I'm just going to take one more today, and then I'm going to try to do some more videos over the next week or so, as this is really just blowing up right now. What about, will vitamin D or other natural treatments save me from COVID? This is a great question. I mean, the answer is honestly yes and no. You know, in healthcare, I think we need to avoid all or nothing thinking. Vitamin D will boost your immune system. There's lots of data showing that it makes you less likely to die from COVID if your vitamin D levels are normal. As a physician, I try to balance normal Western medicine with natural medicine. I mean, I personally even came out with a product this year for our pain patients that has vitamin D in it because it helps with pain, and it also has been shown to help with COVID. So I think that's great. But you can't do vitamin D as a replacement for a vaccine. That's kind of crazy. The data shows that vaccination will save lives at like a 99% rate. And, taking vitamin D may help you 10% or 15%. And so the right balance is to get to your right weight and eat healthily and exercise and take vitamin D and zinc and magnesium and all these wonderful natural things that you can do to prepare yourself to fight COVID, but also get vaccinated and probably, start wearing a mask again. And it's probably, start socially distancing again and washing your hands. There are mathematical things that we can do that will crush this disease. And then we can do other things like take vitamin D and exercise, and that's great too. But it can't be all or nothing. It's not all vitamin D and it's not all vaccine. It's a balanced approach. That's what I try to do with my patients at our clinics as well. I think that's the last question I'll take today. We're at about 10 minutes. I'm going to put tons of links below. God bless you guys. Stay safe. Please get vaccinated. It'll save your life. Have a great day.